Perinatal bipolar disorder. So there is a cycle of up and down, but it's not the baby blues cycle, right? It's mania and depression, and each phase lasting 4+ days. So elevated mood, a persistently elevated mood, which means the way it manifests is decreased need for sleep. So in the postpartum period, usually parents complain about lack of sleep. In this case, when you're in a manic state, you don't feel the need for sleep. So there is a sense of decreased need for sleep and periods of over average productivity. There is rapid speech, overconfidence, to the point of delusion sometimes. So it should be easy um, to see, so to speak, with the naked eye, because it's not what you expect at all. You expect people to say, I can't do anything and I can't be productive, but here they do more. So risk factors for bipolar disorder is a family or personal history. 1 in 3 birthing people with personal history relapse during pregnancy and postpartum. Like I said, if the person had previously been diagnosed and was on medication, then they need to be closely monitored and probably go right back on meds after the birth. But if they weren't previously diagnosed and it's an onset, it's a different story. Perinatal people taken off or started on a mood stabilizer might trigger perinatal onset. They may experience their first psychotic episode during the perinatal period. It can be a rapid onset, meaning it comes on quickly, and a rapid decline. It can look like a very severe depression or anxiety. So people with bipolar disorders have the worst kinds of depression, so to speak. Most successful suicides that come as a result of a mood disorder come as a result of bipolar disorders, because the highs are highs and the lows are really, really low. Basically, it can go into a place of hallucinating. If somebody's hallucinating, they will be either hearing things, auditory hallucinations, or seeing things, visual hallucinations. So if they tell you that they're hearing this or that, you might want to ask, are the voices coming from outside or inside? They will hear it as coming from outside. They will hear it as the TV commentator actually giving her some commands. That's when you know this is psychotic, basically. They can have delusional beliefs without hallucinations. The mom who had to watch her baby sleep because of fear of SIDS, that could take on a delusional intensity. I don't know. But, the paranoia of something bad is going to happen to the baby, somebody's going to come and steal the baby, it becomes delusional. A manic episode, and a depressive episode as well, has a cognitive disorganization. And by cognitive, we mean the way they think and the things they believe. So there are the feelings, which are the sadness, the hopelessness, helplessness, but there are the beliefs that accompany those feelings, like I'm a bad mother, my baby would be better off without me. That's what we mean by cognitive disorganization, or the brain fog can be a sort of cognitive disorganization. In a manic episode, it looks super confident, like they want to start a new business or they want to go buy a commercial building. Um, in fact, people with bipolar disorder are often have been very successful and have had many bankruptcies as well because that's what they do. They can have hallucinations and delusions, like I just said, insomnia, agitation, fluctuating moods, um, depersonalization, dissociation, and amnesia. This all means that there is a sense of them not being there. Dissociation is probably the one we might be most familiar with, where there is this blank look and people are staring into space right past you.